the President of the Indian Dental Alliance in Kuwait, Dr. John Joy, will address.
His Excellency, Shri Satish C. Mehta, Ambassador of India, Dr. Yusuf Al-Duwairi, Assistant Under Secretary, Ministry of Health, Retired Colonel Dr. S.K. Oja, Officiating Secretary, Dental Council of India, Dr. Jawad Bebahani, Dean, Faculty of Dentistry, Kuwait University, Dr. Ibrahim Ismail, Chairman, the Secretary, Kuwait Dental Association, Dr. Muhammad Al-Mutairi, Chairman, Kuwait Medical Association, my distinguished guests and my dear colleagues. Let me start by extending a warm welcome to you all and a good evening. At the onset, I wish to thank our dignitaries on the dais for honoring us with their presence. I also thank those who accepted our invitation to the dais but were unable to attend due to other urgent commitments. These eminent dignitaries include Dr. Ibrahim Hadi, the KIMS Secretary General, the Chairman of the Indian Doctors Forum, Dr. Narayan Namburi, and Dr. Dibyendu Mazumdar, President of the Dental Council of India. I also wish to extend our congratulations to our sister organization, the Indian Doctors Forum, on whom was conferred the Pravasi Bharati Samman Award from the President of India for their outstanding work in the social and humanitarian field in Kuwait. IDAC congratulates its chairman, Dr. Narayan Namburi, the President, Dr. Amir Ahmed, the General Secretary, Dr. Jagannathan, and all the members of the IDF on this outstanding achievement. You are an inspiration to us. Today I am here in two capacities: as the third President of the Indian Dentists Alliance in Kuwait and as co-author of the Foreign Dentist Handbook, which is due to be released today. Being elected as President was a huge honor for me and a chance to give back to our past office bearers and our members the immense sacrifices they have put into this organization. It was also an opportunity to take this organization to new levels and to change minds and perceptions. When we set our targets for the Alliance, even my fellow office bearers were incredulous. The targets looked pretty steep, but standing here today, I am proud to say we have achieved 99% of our goals. Firstly, we increased the size of our fraternity membership from 147 members to 220 members. In October 2012, we launched our official website, www.idakuwait.org. Finally, I am pleased to announce that since the inception of IDAC, we have reached an important milestone. The Kuwait Dental Association has formally given us the privilege of being affiliated to them. Ladies and gentlemen, today IDAC is an official affiliate of the KDA. I thank the Chairman, Dr. Ahmed, the Secretary, Dr. Ibrahim Ismail, Dr. Yusuf Al-Duwairi for granting us this privilege, and I hope we can live up to this heavy responsibility and take this partnership to new heights. Our target for the term was 3 publications. Today we are proud to present and release 2 of them: the Oral Health Guide Volume 3 and the Foreign Dentist Handbook, which is the first ever English to Arabic language guide for dentists, for doctors. Again, we are grateful to the Kuwait Dental Association for sponsoring its publication, and I'm sure that this book will be immensely popular to all non-Arabic speaking dentists working in the state of Kuwait. And I thank all my trainees who were with me and who helped me translate all those difficult words from Arabic to English. It's been a painstaking process over 9 years, but alhamdulillah, we have finally done it. We've come to the release of this book today. Our third publication is a directory which is due to be released later this year. As doctors, we have a very noble responsibility towards the welfare of the public. Service to society sometimes requires us to go beyond the call of duty. As part of this calling, IDAC has conducted a record number of community welfare programs this year, both alone and in partnership with the IDF, the Indian Doctors Forum. Our focus this year was on children with special needs, and in this regard, 3 special needs schools were visited by our staff, by our members. Also, for the first time, IDAC has extended its activities to Kuwaiti schools and schools of other nationalities. I am proud of our members who have come forward without any hesitation, reservation on holidays and on weekends to take part in these activities. For the first time, IDAC went on radio, on air, reaching out to the public through the popular radio talk show Doctors for You on UFM, offering valuable advice to the public on oral health problems. We are ever grateful to the Ministry of Health, Government of Kuwait, represented through our dear Assistant Under Secretary Dr. Yusuf Al-Duwairi, who has been with us from the very onset and given us his unconditional support and affection. He has held multiple positions over the years and has tirelessly worked to lift the standards of dentistry in Kuwait. And under his leadership, we have seen the greatest expansion of dental services in the history of Kuwait. Dr. Yusuf Al-Duwairi. He is indeed a role model for all of us. He is also the most approachable official in the whole of Kuwait. This is, I believe it, true. In spite of his hectic schedule, he still finds time and patience to hear and meet anyone, even if he is big or small. We are also truly grateful to our ambassador, His Excellency Sri Satish Mehta, who has always received us with warmth and listened patiently to us. And I have learnt a great many things from our ambassador. His valuable guidance was a constant encouragement and is instrumental in elevating us to where we are today. I thank retired Colonel Dr. S.K. Oja, our chief guest for the evening, for coming all the way from India on a very short notice. Dr. Oja is a government official at the helm of affairs of the Dental Council of India, which is the highest policy-making body for the dental affairs in India. Since 2009, Dr. Oja is instrumental in forming policies related to dentistry in India. With the large number of dental professionals graduating from India and contributing significantly in terms of knowledge, skills, and literature to our nation and nations around the world, policies decided by the DCI has a definite impact on dentistry around the world. Dr. Jawad Behbahani is our dean from the Kuwait University and an astute scholar from Harvard Dental School of Medicine. Dr. Jawad was instrumental in creating the Faculty of Dentistry, which is, I believe true, is one of the finest in the world, as I've had the opportunity to work in the faculty for a short while. We are fortunate again to have Dr. Mohammed Al-Muteri, and we believe that a close partnership with the Medical Association is very instrumental. Again, he had a very busy schedule today, and we were not really sure that he was going to make it, but I'm glad that you have come, and it's a pleasure meeting you, Dr. Muteri. I wish to thank all our advertisers, sponsors, and well-wishers, many of whom have supported us through the years. Companies and sponsors are important to all organizations. Through their generosity, they have not only contributed to IDAC activities, but also to all the social welfare programs that we conduct. My sincere gratitude to our official sponsor, IACO, which is a premier company serving the people of Kuwait since 60 years. Our congratulations to IACO on its 60th anniversary, which also happens to coincide with today's program. I would like to also thank our other premium sponsors, Zayani Company, Advanced Technology Company, Quality Sources, Al-Mullah Exchange, Al-Badr Scientific, Taiba Hospital, Ashraf & Company, and My Tour Compass. The success of all organizations is built on the selfless sacrifice and efforts of an extremely dedicated team. To this end, the great teamwork and dedication shown by our office bearers, working committees, and other volunteers is truly exceptional. Your service to the members of IDAC and to the wider society has been given without any reservation or hesitation. All of us are truly indebted to you. My congratulations to the editorial team for the Oral Health Guide 2013 and the Foreign Dentist Handbook. To the finance and public relations teams for the exceptionally brilliant fundraising campaign. To the public relations team for the record number of community service programs conducted. To the sports team for generating extraordinary interest in sports and for uniting all through sports. To the scientific committee for organizing the scientific activities and the Oral Health Guide release function. The cultural team for the beautifully organized show, which is going to be displaying our rich culture and heritage. The web moderator for the creation of IDAC's first ever web page. The mail moderator for brilliantly managing the group mail. Our membership secretary and the team of area representatives for the record rise in memberships. I thank the little ones and the spouses of our members who will be performing for the cultural show today. And of course, my very own dear council who have tirelessly and gracefully carried out the responsibility of running IDAC and bringing it to new heights. It is indeed an honor to serve as your president. Thank you.
Yes, indeed. Thank you, Dr. John. And surprise, surprise, it's not just the book release, but today we can proudly say that we have been affiliated by the Kuwait Dental Association. I think one more round of applause, which deserves it. Thank you, Dr. John, for your efforts. We appreciate it. And now, I request His Excellency, Sri Satish C. Mehta, Ambassador of India to Kuwait, to give the inaugural address.
Dr. John Joy, President of Indian Dental Alliance of Kuwait, distinguished guests on dais with me, now need no introduction, and some of whom I have known for a while now. Distinguished guests, ladies and gentlemen, it's indeed a matter of great pride for me to be with you today. It's a wonderful occasion. Number of achievements, as Dr. John Joy listed, are great causes of celebration. When Dr. John had come to meet with me some time back to invite me for this occasion, I readily said yes for two reasons, one lighter, one serious. The lighter is that you can bear with pain in the neck, but you really can't bear with pain in the tooth. It's always good to be on the right side of dentists. But on a more serious note, you know, the enthusiasm with which he came, the ideas that he had, the commitment that he showed was infectious. And I immediately said, yes, I'll be with you. And I must say, it's a great joy for me to be with you today. First, the professional contribution, which for any professional is very important. Bringing out a professional volume is never easy. You need to really get in touch with a number of professionals to contribute, put it together, and it has to be of a certain quality to be acceptable because all of you know your work. The second was reaching out to those who are new in Kuwait, in the medical profession, particularly in dentistry. And this guidebook, I think, is the first of its kind that at least I have seen, where you help professionals through this handbook that you are bringing out today. And thirdly, beyond professional competence and helping your ilk, as I would say, which is your fellow dentists, is a contribution that you make to society beyond and outside the call of duty, which was through assisting people in schools and elsewhere who did not otherwise have ready access to dentists. And all these three points, IDKAS has done very well. So congratulations, and it's for me is a matter of great honor to be associated with an organization such as yours. I'm also happy that you'll be showing the richness of Indian culture to this audience, some of whom perhaps may not be as familiar as others are, to the enormous wealth of culture that India has and of which we can be truly proud. It's accumulation of thousands and thousands of years of work, refinement, and it's a culmination of it, and I'm sure what you present would reflect all that we have received and accumulated over many generations and many contributions that have gone into making what we are. The fact that you have been recognized as an affiliate of Kuwait Dentistry Association shows how truly your work is being recognized in Kuwait, which you have now made your home, and with which India has a long history of close relationship. I must say I'm very new to the Gulf in the sense this is my first posting. I never dealt with Gulf when I was posted in Delhi. It was other countries, other areas I dealt with. It's only after coming to Kuwait that I've realized how intense the bonds are between India and Kuwait. I mean, I've been to so many diwaniyas, and there are people who know more about southern India. I don't come from southern India, I'm from North India, who can relate so many stories and whose sheer depth of fondness for India was something which I did not read in briefs. I mean, you read briefs, you are coached as it were when you're coming on the next posting. But the depth of this relationship I only figured out, and I'm figuring out after coming here. I think it only puts an additional burden on not just me, but all of us, all Indians here in Kuwait, to take it forward. I'm glad you are doing it through remarkable contribution. So thank you, and for first easing my burden and making it much more easier for all Indians here to be able to showcase so much that is good about us. Lastly but not least, by your work you enhance pride and prestige of Indians in Kuwait, because India has seen through the prism of your contribution, your professionalism, your competence, and your caring attitude. So please, as and when you deal with patients, do remember that you are not just dealing with them as a professional, but also through what you do, others see India. Thank you very much for inviting me, and you'll have to excuse me that I will not be able to stay with you for the entire duration because I unfortunately have other commitments. But I wish you a very, very enjoyable evening. Thank you.
Thank you, sir.